Hello, and welcome back to our little class. Before we get started today, I'd just like to take a note as to everyone who's here. Let me get my sheet here. Okay. Alright, let's see. They're here. Okay. Wonderful. Okay. Oh. And our friend Kyle, as well as Chad, have brought a new friend today. Kyle, would you mind introducing us to your new friend? Derek. Okay. Well, Kyle seems to be in the recruiting mood. Is there any particular reason you brought some friends today? Of course. Everyone heard? It's Cranial Nerve Examination Day. Wonderful. Well, Derek, you are more than welcome to make yourself at home in our class. If you're going to audit the class, I would like you to talk to me first, though. Don't like people showing up in the middle of the semester. And I will advise you to maybe find a different seat the next to Kyle. Okay, and we seem to have everybody, including you, my favorite student. Great. So, as I've said before, it is a very exciting day today, as everyone seems to quite enjoy the cranial nerves examination as part of our unit. So if I could take a volunteer for the class, if they would like to come up. Of course, my favorite volunteer is you. So class, today we are going to be talking about how to examine the cranial nerves and note any particular irregularities. And we may have irregularities due to injury or disease, infection, what have you. And in this examination, it's our job to check for all of these abnormalities and to write our findings and go into a course of treatment if there are any irregularities. So your cranial nerves are, of course, your nerves that are located. They start in the brain and they go to different senses primarily, although you can also find them to be governing your muscles, sensation in the muscle, muscle weakness, muscle strength. They are extremely important, and there are 12, although sometimes 13. However, we don't generally count 13, but 12. So, let's see here first. Is the 0, and our 0 is going to be the terminal nerve. The first will be the olfactory nerve. The second is the optic. The third being the oculomotor. The fourth is the trochlear nerve. The fifth is the trigeminal nerve. The sixth is the abducens nerve. The seventh, the facial nerve. The next is going to be quite a long one. The vestibulocochlear nerve. Next is also sort of a mouthful. The glossopharyngeal is number 9. Number 10 is the vagus nerve. The next one, 11, although I messed up a little bit. It's supposed to be A, C, C, E, S, S, O, R, Y, is the accessory nerve. And number 12, although if we count number 0 would make 13, is the hypoglossal nerve. All of these nerves have very special properties and very special ways to test how they're working. So, of course, class, we're going to start first by sanitizing our hands. I will be donning a pair of gloves for this examination, although it is not necessary. We also would like to introduce ourselves to our patients and get their name and date of birth. Hello, my name is Dr. Calliope. I'm going to be performing a cranial nerves examination on you today. Can I please ask for your name and date of birth? Okay, wonderful. So this test is going to involve me checking your eyes, checking your ears, asking you to do some facial movements and some other movements. Is that okay with you? Wonderful. Okay. At any point, let me know if you have any discomfort or any pain, okay? Okay, thank you. So, after we have gained the consent of our patient and their information, generally us or a nurse would take their vitals, right? Good. For the purpose of this class, I'm not going to do that. we're going to assume our volunteer has normal, within normal limits, vitals, and we are going to grab a pair of gloves. Now, I'm going to ask the volunteer if they're currently in any pain or a couple other questions. Are you currently in any pain? Okay. Do you have any acute or chronic conditions I should be aware of? Okay. And have you had any traumatic brain injuries, any concussions? And are you taking any medication at all? Okay, thank you. So, our first cranial nerve, I will tell you a little bit about. However, we're not going to test for it. The cranial nerve 0 is our terminal nerve. Now, we're not fully sure what this nerve does. However, it is said to be a vestigial nerve, and it is supposed to help us sense pheromones. So, for the purpose of the cranial nerve exam, that's a little awkward to test, and not really something we want to put our patients through, especially since it's not really important. What's that, Kyle? Oh, you think you could be the test? Well, see, the problem with that, while it would work, is if you came down here and we tested for your pheromones, I think your Axe body spray would probably repulse my class, and then we wouldn't have any class. So, yeah, no, let's not do that. Thanks, Kyle. Moving on. So, our next cranial nerve, where we're actually going to begin, is our olfactory nerve. And this is going to govern our sense of smell. So, for example, if one suffers an injury that severs the olfactory nerve, you no longer are able to smell. Not a very fun process, as smell is also connected to taste. But for this test, I'm going to have our volunteer close their eyes, please. Thank you. And I have this little plastic jar. I'm going to just hold it up to your nose. I want you to smell it and tell me what you think that smell is. Okay, great. It was indeed coffee. This time, I'm going to have you hold one side of your nose, your left or right, doesn't matter. Okay, close your eyes. And this next bottle, I'm going to put under the open nostril. Okay, can you tell me what that smells like? Okay, it smells like soap. Good. And now if you could switch sides. Great. Keep your eyes closed. Okay. And what is this smell? Kind of smells like toothpaste. Alright. It's mint. Thank you. You can open your eyes. So our olfactory nerve test has been normal. Now we're going to move on to the optic nerve, which is going to govern our vision. So we're going to be using the Snellen test in just a few moments, but we're going to start. We're going to start with a little bit of a look. I'm going to come in a little closer if you don't mind. So first I want to inspect the pupils for their size, their alignment. Noticing any ptosis at all? No, you look quite normal. So, after that, we can go ahead and do our Snellen chart. So normally, this would be held quite a ways away, probably on the wall, but for the purpose of this, I'm just going to scoot back. And I want you to read off what I point, okay? Mm-hmm. 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 Okay. Wonderful. Now, normally, we would have the patient cover one eye and then the other, but just for the purpose, smoothness of the class, we're going to just do the normal reading. Okay, and after that, we're going to be testing for direct and consensual pupillary responses. So I'm going to get in a little close again, and what I'm going to be doing is I'm going to have you look at my nose, and I'm going to shine this light into your eye one at a time, and I'm going to be testing for the direct and consensual response. Okay? Alright, so I'm just going to hold my hand right here. I want you to just stare at my nose. Direct. Direct. Consensual. Consensual. Okay? Direct. Direct. Consensual. Consensual. Okay, so what we're doing here, of course, is going to be when the light shines directly into the eye, that eye will constrict in accordance to the light, and when I shine it again, the opposite eye should also constrict in accordance to the light, and that'll be our consensual response. Now after that, we can do the swinging light test. So I'm going to have you again look at my nose, and I'm just going to shine the light and swing it back and forth. Okay, wonderful. I want you to look at the wall behind me. And now I want you to look at the tip of this pen. Great. And that's going to be our test for accommodation, to which we are testing the constriction and convergence of the pupils. Now normally, in a full cranial nerve exam, we would also be testing for color vision, using those tests that I'm sure you're familiar with, where you have a number in the middle in one color, and it's surrounded by dots of another color around it, and those are called Ishihara tests or Ishihara plates. However, for the purpose of this class, we're not going to be doing that, okay? Now I'm going to be testing your peripheral vision now, or your visual inattention. So I'm going to hold my hands up and wiggle my fingers. I want you to stare right at my nose and just say yes when you see the fingers wiggling, okay? Mm-hmm. 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 Good. 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 Wonderful. Okay, great. Now I'm going to be checking your visual fields. I want you to put your hand over your left eye, and I'm going to be putting my hand on the opposite. So your left, my right, and I'm going to be bringing my hand in. I'm going to wiggle my fingers. When you see them enter your visual field, I want you to tell me yes, okay? Okay, ready? Cover your left eye. I'll cover the opposite. All right. Good. Good. Great. Okay, now I'm going to have you cover the other eye. I'm going to do the same. Great. Good. Good. Great. Another test we would do in a full cranial nerve exam would be a fundoscopy. However, we're going to skip that and move on to our next group of nerves. Now, we're going to skip one nerve in particular just for the moment. So now we're going to test number 3, number 4, and number 6. We're going to test the oculomotor, the trochlear, and the abducens. And these are going to govern your eye movement. So, before I do anything here, are you noticing any double vision whatsoever? Okay? If you do at any point during this test, let me know, okay? Okay. So I'm going to have you follow my finger, okay? We're going to do an H test, whereas I move my fingers in an H pattern. I want you to keep your head still and move only your eyes, okay? Great. Just follow my finger. Follow my finger. Now what I'm also looking for here is any nystagmus. I want to make sure that the eyes are tracking with each other, that there's not any gaps. Great. Now we're going to be testing the trigeminal nerve, which is nerve number 5, and this is going to garner our facial sensation. So in this test, I'm going to be taking this cotton bud and pulling out the cotton a little and fashioning it into a little point here. Now normally one may do this with cotton wool, but we're going to use a Q-tip. So I'm just going to brush this on the side of your neck, and you can tell me if you feel that. Okay, you can feel that? Okay. And now I'm going to be testing your fine sensation in each of the 3 areas that the trigeminal nerve governs. So I'm just going to have you close your eyes first. Okay. I'm just going to touch you and tell me if you felt that. Okay. And that. And that. Good. And that. And that. Great. And that. And did it feel the same on both sides? Very good. Now I'm going to also be testing your sensation with this little safety pin that has been sanitized. So I'm going to just press this very gently on the side of your neck. If you could tell me you could feel that. Good. Right, it is like a pinprick. It's not painful. It's not going to draw any blood. And I'm going to do that exact same test. However, I'm going to do it with the safety pin instead. So if I can have you close your eyes. Just going to touch. Okay. Touch. Felt that? Felt that? Felt that? Felt that? And felt that. Good. So the trigeminal nerve, the three areas that we're testing, of course, is going to be the ophthalmic region, the maxillary region, and the mandibular region. So usually we'll test the side of the face, next to the upper mouth, and on the chin on the lower mouth. The trigeminal nerve is also going to be part of the temporalis and masseter muscles. So I'm going to feel your temporalis muscle. I want you to clench and unclench your jaw. I'm going to feel the temporalis. Clench your jaw, please. And relax. Good. I'm going to feel the masseter muscle. You could clench your jaw and unclench. Great. Okay, so I'm going to put my hands at the top and bottom of your head. I'm going to have you open your mouth and don't let me close it. Okay, great. I want you to close your mouth and don't let me open it. Good. Now something else we're going to test. Just need to get my reflex hammer out. Okay. This is going to be the jaw jerk reflex. I want you to open your mouth slightly and relax your jaw. And I'm going to put my thumb on your chin. Going to just tap, tap. Okay, good. In a normal reflex, this should have pretty much no reaction whatsoever. Now the last thing we can do, although we don't normally do it, is the corneal reflex. So I'm going to just make my other side here and do a little tip. There we go. So what I'm going to do for the corneal reflex is I'm going to pull down your eyelid and have you look upwards. And I'm going to touch this little bit to your eye, and well, I'll tell you what should happen afterwards, if that's okay. Okay, so I'm going to pull down, look up. There we go, just very gently. Okay, so what should have happened is a direct and consensual blinking. Both your eyes blink. Yeah, good. Now we're going to be testing cranial nerve number 7. And this is going to be our facial nerve. So this is going to be part of our facial movements. So what I want you to do is raise your eyebrows. Good. Clench your eyes tightly. Good. I want you to puff out your cheeks. Good. I want you to smile. frown. And show me your teeth. Good. Oh, and can I also have you purse your lips, please? Good. Okay. Have you noticed any change in taste at all? Okay. And has your hearing seemed louder than usual lately? Okay, good. So now we're going to be testing the vestibulocochlear nerve, and this is going to be part of your hearing. So first, I want to just take a quick look at your ears, if you don't mind. Just going to look at that one and the other. Okay, no lesions, they look just fine. So now what I'm going to do is I'm going to cover one ear, and in the opposite ear, I'm going to whisper something. I want you to just repeat back to me what that is, okay? Okay, good. 99. 67. Good. And now the other. 42. 73. Great. Now we've covered these two tests that we're going to be performing before in this class. So now, as part of the 8th nerve exam, we're going to be testing the Rene and Weber tests. So first, we're going to start with the Rene test with a 512 Hertz tuning fork. And what I'm going to do is strike the fork and put it on the mastoid process behind the ear, and we'll go from there, okay? So first, tell me that you hear that, and when it stops, okay? And do you hear it now? Okay, good. When I put it in front of your ear, you should still hear it, as the air conduction is supposed to be longer than the bone conduction. I'm going to do that to the other side. Can you hear that? Tell me when it stops. Okay. And do you still hear it? Good. Rene test is complete. Now I'm going to do the Weber test. Going to place the tuning fork in the middle of your forehead. I just want you to tell me which side you hear the sound on the most. Okay, equal on both sides. There's no lateralization of sound, which is normal. Okay. Now we can also do the turning test, which is going to be you standing up for the class, and I want you to close your eyes and march in place. Can you do that for me? Okay. Close your eyes and march just in place. Okay. Alright, you can stop. So sometimes if there's an abnormality, you'll go one side or the other, but you stay just straight right up. We're getting near the end of our cranial nerve examination. So next we're going to be testing number 9 and number 10, our glossopharyngeal and our vagus nerve. So first what I want you to do, let's see, I've got everything ready there for that. I want you to open your mouth and say, ah. I'm just going to look inside. Let me get my light. So I'm just inspecting the soft palate and the uvula for movement and symmetry. There's no deviation of any kind of the uvula. Now I'm going to have you cough for me. Okay, good. Now I'm going to get you a glass of water. In a never before used cup and a never before opened water bottle. So I'm going to give this to you, and I want you to take a sip of that. Okay, hold it in your mouth a second and swallow whenever you like. Okay, great. Alright, now we're going to be testing the accessory nerve. So first, what I'm going to have you do is I just want you to shrug your shoulders. Okay, good. I want you to keep your arms hitched up and don't let me press them down. Good. And that's testing the trapezius muscle. Now I want you to turn your head. I'm going to have my hand here. Turn your head. Don't let me keep it from turning, okay? Just turn your head. Great. And turn your head. Wonderful. And that tests the sternocleidomastoid muscle. And our last one is going to be the hypoglossal nerve. So I want you to just open your mouth and let me look at your tongue at rest. Okay, good. And now I want you to stick your tongue out. Okay, can you move it from side to side? Good. So there was no deviation, there wasn't any movement restriction. And now I'm going to have you press your tongue to the inside of your cheek, and I'm just going to press against it. Don't let me press it in. Good. And the other side. Good. All right. And that concludes our cranial nerve examination. Is anyone having any questions at all? Okay, good. So this was our example of a normal examination. I could conclude that this person has intact cranial nerves and will not need any treatment. Okay, so I thank you all for coming to this class today. Even you, Kyle, and Chadley, and Derek. And I look forward to seeing you all again very soon. Thank you for coming in. I hope you all have a whale of a day.